Greetings from KIMS Hyderabad. I am Sandeep Attawar and I am here to tell you something today. Let me begin by giving you the reason you should come to KIMS Heart and Lung Transplant Institute for a transplant. I would like to call this the KIMS model of care, something which is particularly suited to great outcomes. The core of our care model is close consultation. And what I mean by that is a daily combined ICU round of every single transplant recipient. And this interaction is followed by a cross consultation between a number of different specialties during a sit-down team meeting every single day. And this team includes transplant cardiologists, surgeons, pulmonologists, infectious disease specialists, transplant intensive care, nursing and doctors, nutritionists, and rehabilitation specialists. And any potential transplant recipient has multiple limitations that are primarily caused by their failing organ and its effects on the rest of their bodies. And these are sometimes amplified, unfortunately, by disease-modifying medications that may include steroids. So pre-transplant evaluation or rehabilitation, nutritional supplementation, and physiotherapy not just play a vital role in arresting this decline, but also help immensely in building up reserve and making them better candidates to understand and withstand a tenuous operation, thereby reducing ICU stay in the post-transplant phase. A transplant evaluation done before the transplant also does help to identify and plug many modifiable gaps in a recipient's overall health, which goes a long way in their recovery and their long-term health. In the spectrum of all solid organ transplants, the challenge with the lung transplant is very unique, as this is the only organ, when transplanted, that is open to atmosphere. And this makes its aftercare even more special and even more difficult. Our negative pressure transplant isolation rooms with personalized care and strict barrier nursing, round-the-clock telesurveillance are the pillars of patient care after a transplant. Early mobilization and aggressive rehabilitation with the most up-to-date of equipment and specialized rehabilitation teams not just strengthens this phase of recovery, but bolsters it in a great way. We have something that we like to call our new Organ Restoration Center for lung transplantation, which will provide a great opportunity for us to deploy ex vivo perfusion organ models to the donor lung. The principle is called lung rejuvenation and enhancement. Here, the organ is actually supported outside the body, termed ex vivo, on a machine that supplies it with nourishment, treats it with antibiotics, while physicians closely monitor its progress. When repaired, enhanced and assessed over a period of time and then found to be meeting those very exacting standards of a standard lung, only then can we use it for a transplant into a recipient. This is a game changer because this technology will contribute to increasing the safety margins of a transplant and also augment the number of total lung transplants performed in this country in the next 5 years by not just expanding the donor pool, but also making this therapy more accessible to meet demand.
As an entrepreneur, as being the Managing Director of the Krishna Institute of Medical Sciences, and especially I being a cardiac surgeon, I feel very honored by myself and the entire team. Heart and lung transplant program was much beyond my thinking, has been successful, and a lot of the patients do get a benefit out of it.
We were very fortunate to meet with Dr. Sandeep Attawar and team, and what we've been able to achieve together in the last 1 year has become a beacon of excellence, and we've also been able to set new standards in the field of medicine. We are happy to be credited as the largest heart and lung transplant program in the country. We're also one of the largest post-COVID double lung transplant programs in the world.
And while it is very painful to see someone struggling to breathe when they wait for a lung transplant, it is exhilarating to accomplish a successful transplant. What is even more gratifying is to be able to see them at the time when they leave the hospital breathing like a normal person. And that spark of happiness and that satisfaction is what gets me going every single day, every time. And this is the motivation that is enough for us as a team that promises to be relentless in the pursuit of perfection. Thank you.